Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Schizophrenia. Let's look at the drugs and also the mechanisms. So first is there is a typical. Typical means the first generation antipsychotics. This can include the chlorpromazine. Then there can also be the triflupromazine, then the thioridazine, the fluphenazine, the haloperidol, the droperidol, the penfluridol, then comes the thiothiaxine, then the flupentixol, the reserpine. Next is the sulpiridine, sulpiride. Next is the loxapine, the pimozide, also the pimozide. So all these comes under the first generation antipsychotics. So when you look at the mechanism of these first generation, it is nothing but there is a D2 antagonism, and the effect is against the positive symptoms. Then on the other hand, there is a atypical or the second generation antipsychotics. So they include the clozapine, the risperidone, that is the most potent, then the paliperidone, the ziprasidone, the ritanserin. Next is the quetiapine, the asenapine, the aripiprazole, the olanzapine, the certidol, the raclopride, then comes the lurasidone and the remoxapride. So what is the mechanism of these? The mechanism is there is the D2 as well as a 5-HT2. So D2 and the 5-HT2 antagonism. So these are the mechanisms. Now looking at the effective against. So they are effective against the positive and the negative symptoms. To learn and grow daily like this, please do subscribe.